So for everyone, good morning, good afternoon, or good evening, depending on where you are on the world at this time point. Welcome to this risk management webinar for business in times of the COVID-19 situation. It's very good to see that throughout the day we held 3 webinars and every one of them has been attended pretty well. So it's good to see that everyone is involved in what's going on. What we're going to do today, first I'm going to do a presentation myself on CGE and how our take on the COVID-19 situation was, because we constructed our own bowtie, of course. Thereafter, we're gonna listen to Nico Snijman from Crest Advisory Africa, and he has a more governmental approach to the bowtie methodology. And eventually, we're gonna listen to Miguel Grimaldo, and he has a more scientifically medical approach to certain kinds of safety barriers that you can implement in this whole situation. So 3 very different approaches to bowtie and safeguards. And in the end, we will do a question and answer session for all speakers. Some guidelines for the webinar today. Please, everyone, make sure to keep your microphones muted because there are a lot of people in the call, so things can get messy pretty soon. If you have any questions during the webinar, you can post them in the little chat box on the side. You can see a little chat icon and you can post all the questions there that you have. My colleague Evelyn will keep track of them, so she's going to make sure that everything will be asked and answered in the end. Don't worry about having to write everything down during the webinar, because we are making a recording as we speak, and we will also share it with you in the end. Also, the presentations will be made available to you, so don't worry about that. We will provide all relevant materials to you in the end. So let's starting off with the CGE part of the presentation. My name is Elise Rovers. I'm one of the product managers of CGE, and basically what we do is we build software and we use the bowtie methodology in order to do so. We build barrier-based risk management software using that specific model. A bit of a disclaimer I have to make here. Today I'm going to tell you about the bowtie methodology, and I must say that I'm only an expert in the method and in our software, so I'm not a subject matter expert when it comes to COVID. So if you have any specific questions on that, maybe you can leave them for Miguel better in the end. Having that said, I will take you through my presentation for today. I'm going to give you an introduction to the bowtie method. Maybe some of you listeners already know the method, then it will be some refreshing thoughts maybe. For others who are joining in and are new to the method, this will be a good solid introduction to it. Secondly, I will discuss our exemplar bowtie that we have built, and this is not the example of the entire universe, but just our take on the topic. Eventually, I will also discuss other potential scopes that you can consider during these times. And of course, you can post your questions already in the chat, and I will try to answer them in the end. So first, bowtie. Why we're so keen on this model? It's because actually it's a very easy to understand and easy to interpret model to visualize your risks. So what you will do, you will visualize potential risk scenarios, and this makes it very easy because the bowtie is coordinated in a scenario line structure. It will make it very easy to structure your thinking when it comes to your risks. And this makes it possible to very easily identify certain safety barriers along those scenarios, and in the end also makes it easier to manage those barriers. What you will facilitate by doing this is making risk-based decisions more easy, and eventually you will also have one common language to communicate that risks. So either when you are communicating bottom up or top down, it doesn't really matter. As long as your organization decides upon this model, everyone will be able to understand what's going on. So we think it's a very easy model that also makes it very easy to communicate throughout the entire organization. So it's a qualitative model, and actually what it does, it simplifies reality without oversimplifying it. So that's why we are very keen on the model itself. We usually advise to build the model in 8 steps, and I'm going to walk you through it. Just for the people who don't really know it, it will be an introduction, as I said. For the people who will know it, it will be a refresher, and hopefully I can give you some guidelines that will help you to build even better models. So you first start off with the first element, which is the hazard. And the hazard is, together with the top event, the center of your bow tie. And this is with some thought, of course, because the hazard and the top event together will be sort of the backbone for your entire bow tie. So the whole scope of the bow tie will depend on this hazard and the top event combined. The hazard is an interesting element because lots of people think when you hear the word hazard, that you are in danger or anything. And this is not the case. The hazard is actually a very neutral way of describing your normal operations. However, you use bow tie in sort of hazardous and risky operations. So there is a hazardous energy involved in your hazard, but you're actually describing it in the way that you want your hazard to be. For instance, driving a car or storing chemicals or drilling for oil. These are all examples that contain a hazardous energy, but in its neutral state, it's not a danger. Then the second element is the top event. And the top event is actually the first moment when you start to lose control over your hazard. Again, as of yet, nothing really bad has happened yet, but it's the first moment when you start to derive from your initial plan. So you start to get off track from where you want your hazard to be. So when you're driving a car, the top event would be losing control over the car. Storing chemicals would be the release of those chemicals. Drilling for oil would be I don't know, losing some oil or getting a leakage. So this is actually where you don't want to arrive yet. However, nothing really bad has happened. You can still recover and get back to normal operations. The third element would be the threats. And threats are actually the causes that will lead to your top event. On the right-hand side, you have the consequences. And the consequences are the negative outcomes that you're trying to prevent from happening. This is where the barriers come in, and the barriers are, of course, the things that are going to prevent this chain of events from happening. So you place preventive barriers on the left-hand side that will either eliminate a threat altogether, or they make sure that if a threat does occur, that it won't lead to your top event. On the right-hand side, you see the recovery barriers, and they are either meant to make sure that a top event will not lead to any consequence at all, or it will make sure that if a consequence does happen, that the recovery barrier will mitigate the effects of those consequences. For a 7th step, we have escalation factors in the model, and those are actually all the things that you can imagine that will degrade your barriers. So they are connected to specific barriers, and an escalation factor unfortunately makes sure that your barrier won't function at 100%. Of course, you don't want this to happen, so that's why you also try to install an escalation factor barrier. And this will make sure that the escalation factor does not have any effect on your barrier at all, or if it does, that the effect will be minimized. So in short, that's the entire model of bowtie. With our team, we sat together and we said, okay, the COVID situation is occurring. We're going to build and construct a model that people can use and can work with. And we decided to build it from a business perspective because that was, for us, the most relevant one and the one that we also know the most about. So what we did was we decided upon a hazard, and sadly enough, operating in an area where COVID is present is now part of our normal operations. So that's why we decided this is our hazard. This is our current situation. It involves a hazardous energy, but nothing bad has happened as of yet. We connected the top events to it. An employee is infected with the COVID-19 virus. Of course, you don't want this to happen, so that's why it's a top event. It's starting, it's the first part where you start to lose control over the hazard, but still you can try to recover from it, so it won't lead to any consequences. So this is the backbone of our bowtie, and actually in the process we had to remain focused and we had to remain sharp on keeping the focus and remembering this is our scope and we're building it from a business perspective. We thereafter started to identify the threats, and we were sort of inspired. There were already clients and partners that were building bowties about this topic. We were sort of inspired because they had many threats. They had going to meetings together, shaking hands, touching surfaces, etc., etc. So in the spitballing phase, we came up with a lot of threats, but in the end, we narrowed it down to the three reasons how you can get infected with the virus. So this was either through inhalation, it was through ingestion of food that's contaminated, or it was due to ingestion after touching infected surfaces. So that narrowed it down because we said, okay, this is actually how you can get infected. So let's focus on those. Eventually, we even dropped one because we couldn't come up with any examples other than the origin of the virus. So we said, okay, this is not really relevant. If you look at the business perspective, this threat may be not as relevant as we initially thought. So we dropped it in the end. Then on the right-hand side, also for the consequences, we started to come up with a lot of consequences. And in the beginning, we got a bit lost because we were over focusing on symptoms. So we said, okay, you have people that show no symptoms, maybe some of the symptoms or all of them, maybe people with severe symptoms. So we started to over focus on this division. And in the end, we said, okay, but this is not the essence of what we're trying to do. This is not the essence of what we're trying to prevent from happening. So eventually, after the spitballing, we started to narrow it down again. And this is actually what you do with building bowties after you've created a top event and a hazard together. You start to come up with a lot of threats, a lot of consequences, and thereafter you're going to narrow down what's relevant for you. So eventually we said, okay, what's it all about is that we will have more infected employees, and this is actually what we're trying to prevent. So it's our consequence. Another one was the workers being unable to do their work, so you will have a decreased business productivity. And the third one was maybe indeed a complication of medical conditions. So your people are getting really sick. So these were eventually the three consequences that we were trying to prevent. Moving from there, we built in all the barriers in between. So these are the safeguards that you're trying to implement to make sure that your scenario line will be stopped and will not reach a consequence in the end. I'm not going to discuss them all. Also, looking at the time, we don't have time to do that, so you can read them at ease after we send it to you. But something to realize, and which is maybe good to mention, is that on the left-hand side of a bow tie, you're actually trying to manage your risks, whereas on the right-hand side of a bow tie, you're really starting to manage a crisis. And this is important to know also in the COVID-19 situation, that a lot of companies don't really know whether they have 1 or 2 or more employees who are infected with the virus. But everyone decided, okay, let's go into crisis mode and make sure that it won't be spread any further. So if you look at the barriers on the left-hand side, you still see that we implement them, but maybe more on a personal perspective today, going to a store or maybe traveling from A to B, whereas most companies are now already on the right-hand side of the bow tie, presuming that they had at least 1 employee that was infected. Something to mention still are the escalation factors. At first we put them in while building the bow tie, then we took them out again. For instance, this had to do with ventilation and the virus spreading through it. And we said eventually, well, this is not the case. And then after a few days, it was in the media that it was indeed the case. So we did put it back again. Also here we have the hospitalization of severe cases. And eventually the hospitals were getting fuller and fuller. So we also implemented an escalation factor over there that also, of course, needs to be mitigated through another barrier. So in short, this is our take on the COVID situation from a business perspective. It's just an example. It's not the truth. It's not covering everything. Our first guest speaker will show you a much more elaborate bow tie. So this is just an example, but please, you can use it. You can ask questions about it and make sure if you want to share it with other people, then you're also allowed to do so. This was a very general business perspective, as I already said, but you can also think about more specific topics. So for instance, transportation is also very important these days. Manufacturing, of course, things still need to be produced, and also the pharmaceutical industry is another one that has to work during these times. So again, sadly, transporting people during a pandemic is the normal operation. And of course, deriving from that normal operation would be an infected passenger entering public transport. That also goes for manufacturing, the dependence on your workforce to fulfill the production. And of course, your top event would be the capacity decreases below a certain percentage that you will need in order to have all your production satisfied. And for the pharmaceutical industry, of course, producing a vaccine would be normal part of operation. But of course, you can imagine that the top event would be the demand that will exceed that certain production capacity. So these are some examples of more specific business bow tie scopes. So that was actually what I wanted to share with you today. And now we're going to listen to another take on the bow tie methodology presented by Nico. I am going to look for you, Nico, and I will provide you with presenter rights. So there you go. Did it work?
Thank you, Elise.
You're welcome.
I hope it worked. Can you can see what is on my screen?
I can see your screen and I can hear your voice.
Okay, fantastic. Just want to get everything right on my side. Hello, everyone. This is our third session for the day. As Lisa said, we had a good attendance, and let's make this fun. Okay, COVID-19 and risk management. So our approach to this is the same as what was shown now with Elise. We were just taking it a bit further. So I just want to give you quickly an overview of what I'm going to be talking about. Who is Crest Advisory Africa? Number one. Secondly, we're doing a country risk analysis using the mind maps and bowties, bowtie XP, and then risk information transferred to the bowtie XP, and then helpful true information, and then way forward questions and contact us. So if we are going for who Crest is, Crest was established in 2014 in June. We are specializing in corporate governance, so we are working in enterprise risk management, business continuity, compliance management, health and safety, and we are one of very few certification companies globally that can certify up to about 20 standards on ISO at present. We've got offices in South Africa, in Botswana, in Namibia, and if COVID is getting under control, we will open offices in New York and in Australia this year as well. Our offerings, what we are doing is that we are having 8 offerings to our clients. Firstly, this training of the highest class training that you can get, advisory services, audits, first level, second level, and independent audits, products that we build for our clients. Technology, we're using bowtie, but we've also got a system with the name of Isolytics that is actually a compliance-based system that we will communicate with you during the next week. Then we've got incubation programs for small businesses, executives, and small and medium enterprises, events, and then our flagship offering is actually international certification of persons, products, systems, trainers, and auditors. So if you're looking at what we are going to do, just want to show you, this morning we've started, and on the left-hand side you will see there the quick facts. 496,081 total cases confirmed, 22,000 deaths, 13,000 serious, and total recovered is 113. And you can see that it is spread all over the globe, from Greenland with 4 to the French Polynesia with 23 cases that is actually in the middle of nowhere, and it has got COVID. And 190 out of the 195 countries has got COVID. So firstly, just a bit of a background. We are working as a consulting house. We are working with the top echelons of business, with boards, executive committees that has got interest in various countries in Africa and all over the globe. And what we were looking at was what is affecting a country, and what is the phases and stages that this COVID-19 is actually going through, and how it is actually now behaving. So we were firstly doing a brainstorming. I like the word that Lise was using, a spitballing exercise. We were using the brainstorming just to make sure that we understand what is in stage 1, stage 2, stage 3, stage 4, and maybe there's stage 5 and stage 6. Stage 6 could be, at the moment, what is happening after the control itself, after COVID-19. So if you're looking at this is now the document that I just opened. I just want to just bring it a bit closer or zoom it in, that what we have done actually through a risk management process went into each one or into each of these processes and causes, and we have actually listed them and rated them as well. So this is how we did our spitballing process, and from the spitballing process, we actually went over into building the bow tie, because in the spitballing process, you don't always know, is it a control, is it a cause, is it a consequence, is it the control for the consequence, is it the control for the cause, and where you are standing. So what we have done is that we have built the bow tie, and we have allocated the allocation to the bow tie itself. And as you can see here, so I just want to put this. Can everybody see my slide?
Yes, we can.
Okay. So thank you, Elise. So what we have built in here is that you can see on the left-hand side the causes and the consequences on the right-hand side. And I just want to say again, this is a country business continuity analysis, because it is not only dependent on a business. Every business is part of a bigger society. The bigger society's behavior and safety culture, etc., is going to affect you, whether it is one of your employees, whether it is one of your executives, and this creates actually a normalized average that a country needs to be actually working with. So we have looked at personal hygiene, initial health screening, toilet facilities. We are working in the mining environment, where we are working with high value goods like diamonds, gold, platinum, etc. And the searching rooms, they are specific searching rooms that is actually looking at everything, and it is very, very detailed, and all of those are a risk and a hazard that you need to manage. Your safety culture, definitely monitoring your own health systems. It is not only dependent on government to be doing that, you've got a responsibility as well. Social distancing, public transport, and preventive isolation. And on the right-hand side, what we have done there, our country has announced on the 16th of March that we are in a state of disaster. So we are now managed by government under the Disaster Management Act. Then we are in lockdown from tonight at 12 o'clock. And what is going to be happening there? Then what is going to be under pressure? And we have seen the behavioral change since last week Sunday evening till this evening. The emotional change and the behavioral change of people, and the psyche of people are actually driving COVID not to be dangerous anymore. It is now actually the people's behavior that is actually more danger, and that we have to manage. Civil unrest and those kind of things that we need to be, and disobedience, citizen fear and panic, and I will address that. Travel restrictions, and then I want to come to financial distress, business continuity plans, invocation, business impact analysis, and all of those are actually the root causes, not at the moment that I can put on the left-hand side, but it is the root causes of everything that is happening with the country. And overloading of the network, demands on the health services that Elise also referred to, and I hope that is never happening, the declaration of a state of emergency. If you look at the bigger picture here, or a little bit of a bigger picture here, I just want to get to the side. In risk management and business continuity, we are speaking of layers of protection, or LOPA approach. So we are actually using, in this whole process, we are using 5 or 6 methodologies pertaining to risk management. Firstly, bowtie is a methodology on its own. Spitballing or brainstorming is another method. If we're looking at the root cause analysis that we are doing here, actually now, it is another method. If we're looking at the layers of approach, as I was indicating here, another method. So all of these are actually creating for you assurance. Now, if you're looking at the first one there, it gives you 8 levels of protection, and if this is adhered to, then the chance for a country to actually, sorry about that one, the chance for a country to go into a state of emergency is hopefully prevented. If you're looking at, there's a lot of focus on initial health screenings across the world. I think we can look at those 2 layers of approach there, and we can ask each other, is this really enough? Can we do more? If we're looking at South Korea, I was looking at a presentation by one of the ambassadors on what they've done. They have got FLIR cameras that is looking at people on a distance. They've got drive-throughs that people don't even have to open a window. So if we're looking at initiative, we can actually go and look at South Korea or other parts of the world that we can actually see, but we can actually extend all these barriers here to make sure that what is actually following is going to be less important, but also very important. If you're looking at just simple toilets are actually the most dirtiest thing and filthiest thing that you can have, because you are going into the toilet, taking a handle or touching a handle, and you enter a toilet. When you are going out, you are washing your hands. The tap itself has been touched by so many people before you. So how do you do that? And especially in a business environment, there's a lot of people that is in a business environment that you have to be worried about, to be looking at, and to actually create a safety culture through communication and through pamphlets and making sure that everybody knows what they are supposed to do, because uncertainty in a business environment creates bigger risks than the actual risk itself. I spoke already about the monitoring yourself. I'm going to go over to the right-hand side where we're looking at the consequences. And if you're looking at the consequences, firstly, I want to say that the state, the announcement of the state of disaster or working under the Disaster Management Act, that has got certain barriers that is actually managing the state of disaster. Lockdown is the critical services are open, but what is actually the critical services? If people are not understanding that, everybody is thinking that they are critical. The utilities, with people that is getting infected, and there's a steady growth on that, the critical environments, the critical institutions are going to be under strain. Electricity, water, education, and this is where we have built in escalation factors to say that what is the alternatives? How can we actually make sure that we are actually working within the parameters of the COVID guidelines, in terms of the World Health Organization's guidelines, and making sure that we don't have civil unrest and disobedience and increase in union activities, because that is going to be the effect of COVID, because people are going to lose money. They are placed on in lockdown situation. They don't qualify for payment because it is not a business decision. It is a country decision. So the unemployment funds all over the world are going to be strained there, and this is going to cause citizens fear and panic, and the panic buying is placing a huge stress on the demand and supply on your financial sectors as well as on your supply chain. And a communication strategy that is proactive, that can actually inform people about even the levels of stock, of critical stock, that that is available, that people can be in a space where they are understanding for the 21 days, and I can guarantee everybody this is not going to be taking 21 days. For China, it has taken about three to 4 months for them to declare COVID-19. There had to be a few days first, and as we have seen, the incubation period is 14 to 21 days, so we can actually trace back the incident timeline to about October of 2019, and this is where the first cases actually occurred. And then the travel restrictions, if you're looking at travel restrictions, the critical borders that is closed, the financial distress of small businesses that hasn't got the financial capacity to actually carry their personnel for a month, 2 months, 3 months, and then the kicking in of business continuity. And this is where I want to focus. Business continuity plans and business impact analysis. I've been consulting in the space for the last 15, 20 years. And business continuity plans, when I look at business continuity plans, most of them are only addressing fire or disruptions in telephones, disruptions in electricity, water, etc. But we have been working for the last 10, 15 years and longer with SARS, with MERS, with other diseases in the world, and none of those have been actually incorporated into business continuity plans. And the invocation of business continuity plans and a disaster recovery plan means actually that people are going home and they are working from home. Selective people, key processes, key staff are actually kept back, or they are seconded to a disaster recovery site. Now, a disaster recovery site, if you understand it, it is actually where a lot of companies are actually buying seats for just this kind of exposure. And now that COVID-19 is so contagious, you cannot put those people in the same room anymore. So you've got a huge challenge to actually look at your business continuity plans now at the moment, your disaster recovery strategies, because those that is actually promulgated and believed to be working globally are being challenged, and that is not working anymore. Then your business impact analysis. What have you done about your business impact analysis? Did you actually look at your critical services and products, your critical processes, your critical staff, and the wellness programs of your staff and of the critical staff, and making sure that your business impact analysis is actually going to be addressing the 3 months or 21 days, maybe 42, maybe 60 days delay in work, and how and when will you catch it up? And then your supply chain failures, where you are going to sit with fuel shortages. With this is a very interesting one here that I just want to address. We are going into lockdown, as I said, tonight at 12 o'clock, and today there was the first hijacking of a load of food. And this is not even in lockdown situation at the moment. This is prior to our lockdown. So the shortages, although you can plan this, there are other people that is actually planning against that as well. So Elise was mentioning the logistical environment, a very critical environment that one need to be looking at, because that creates for you business impact as well as business continuity. Now that people are working at home, the overloading of your internet service providers, we've got at my offices, we've got fantastic internet speed, and that has actually gone down by everybody that is actually working now from homes. That the production of everything is just slower, the communication is just slower, and eventually the declaration of a state of emergency. And what is so nice with bowtie, you can put it in exactly where you want to, and that is the process that is following. because this is so important that one is keeping track of this, because you need to, as we are going along, your crisis management plans, your crisis management procedures, how you're making decisions in this process need to be updated as and when you are going along with this process. Firstly. Secondly, your business impact analysis, that needs to be revamped and be looking at, can we do, one of my clients is a medical scheme, and the critical environment is a call center. And none of those people in the call center has got laptops, has got phones that they can actually go and work from home. So now, with this lockdown, how do you give authorizations for a critical heart transplant or operations? Because the authorizations are now sitting with the call center. The call center needs to contact the authorizations department, and the whole interdependency of your business impact analysis is just flowing to a total different level. So on that, I just want to speak about helpful information. And if we're looking at, and this is really, I've mentioned it there, fear the social disruptor, because that is actually what we're talking about here, people's psyche. And the best place that you can actually get information is the World Health Organization. On this slideshow, all the links are in there. The World Health Organization also has got a WhatsApp group that you can go and register in on. They've got situational reports that you can get on a daily basis. All of these things are available, and what is very important is toolkits. Toolkits is actually guidelines that is already thought out by other people, and that is actually giving you the guidelines as it is. And I just want to show you, just before I that in my presentation, we are now at the moment at 496,000. When I started this morning, we were sitting on 476,000. So just in one day, there were 20,000 new cases. So this is going to be a global spread that we need to be looking out for, and making sure that everybody that we've got a responsibility with to care for, our duty of care as business owners or as managers, that we are actually knowing what is the real information, and that we get real information out to staff, especially now in a lockdown situation, because now communication is much more difficult. So the way forward, we have been doing these 3 webinars today. Chris Advisory will be doing business continuity and leadership, business continuity, the strategies to challenge the status quo there, and business continuity and business impact analysis. We will be doing that next week, Monday, Wednesday, and Friday. So if you want to have further information on that, please, that's my email, and you can also visit our website. And then all the questions that you've got, please list it in the question box, and we will answer it afterwards. Thank you, Elise.
Thank you so much, Nico, and thank you also for the relevant information that you're sharing. Again, we get some questions on if we are sharing all this information, and we will, so don't worry about it. Also, the slides with the links that Nico just showed were also shared. Nico, I would like to wish you a lot of luck with the lockdown tonight and the coming weeks. It was an honor to do the webinars together with you today, and I wish you the best.
Thank you very much.
You're welcome. For now, we're gonna turn to Miguel Grimaldo. I'm gonna make you the presenter so you can take over the presentation.
Hello, good morning or good afternoon. While I set up this, please give me a minute. Oh, there we go. Yes, I go like that. Perfect. Can you hear me?
Yes, we can hear you, Miguel.
Okay, perfect. So thank you very much. Good morning or good afternoon. I work. I do some consulting work on biocontainment and biosafety. I'm assistant professor of Department of Pathology at the University of Texas Medical Branch in Galveston, and I oversee all the high containment laboratory operations for biosafety and for biocontainment especially. We work here with different pathogens, including the new coronavirus, Ebola, and others like that. But today I'm going to be talking a little bit about safety barriers, specific applications of certain safety barriers or basic concepts in biocontainment, and some examples maybe about escalation factors and how we can mitigate some escalation factors. The first thing also I would like to answer some of the misconceptions sometimes about, for example, HEPA filters. Let me see if I could. Okay, so is HEPA filters that, for example, a HEPA filter, the way that they work is that they have multiple ways. First is by inertial impaction when a particle size is heavy enough that it doesn't follow the airflow pattern and it will hit the fiber and the fiber captures the particle. Also by straining, when the particle size is too large to go through to the strain, similar like if you are straining sand in the beach. By interception is when the particle size is smaller, but it goes with the flow of air, but is intercepted by the fiber. Or by diffusion, when the particle is so small that it has its own particular movement called Brownian motion, and that particular site is also captured by the fiber and by electrostatic. When we combine all of these filtration methodologies into the overall efficiency for a HEPA filter, we find that the most, which is this line right here, we find that the most penetrating particle for a HEPA filter is close to 0.3 microns. And then people sometimes misunderstand that if you have something smaller than 0.3 microns, like for example the coronavirus, which is about between 0.1 and 0.2 microns, if the filter would not filter that particle size. And in reality, it does. When we say 0.3 micron is the most penetrating particle, and a HEPA filter needs to be 99.97% efficient for 0.3 micron. So any particle size that is smaller than 0.3 micron, the filter will go towards 100% efficiency. And any particle size that is larger than 0.3 micron, the filter also is going to go to 100% efficiency. These HEPA filters are used sometimes in respirators. And these are some of the safety barriers that we use. For example, the N95 that you have heard very commonly, the N95, which is this mask right here, which filter 95% of particulars of 0.3 microns, right? Now, if this is as a safety barrier, you have some escalation factor. For example, if you select the improper mask size, or if you have facial hair, those can prevent the mask from operating properly. Then for that, you will have to do what we call an annual fit test, or we need to do a fit test to make sure to guarantee that the mask will fit properly. Same thing is for the full face respirators, that they will also require, for example, both N95 and full face respirators will require medical evaluation to guarantee that you can breathe with this restriction now in your face. Because some people may have lung issues and they don't have the capacity to breathe with restriction. The other methodology that we use for protecting individuals, personal protective equipment, is called PAPRs, or Power Air Purification Respirators. These power air respirators, what they do is they blow air in front of your face, and this air is HEPA filtered before it goes in your face. You require training, especially how you gonna decontaminate all this equipment, how before you put it in or after you take it out. It's all a process that you require training. And those are also escalation factors that training would be required in order to use it properly. So, but when we talk about pathogens or agents, they have different levels of resistance to decontamination. And you hear these, like bacterial spores especially, are the most resistant and very hard to decontaminate. That's the reason why we use spores as biological indicator for decontamination process, to guarantee that we have successfully achieved a decontamination. Then in order from most resistant to least resistant, we have mycobacteria, then a small non-enveloped viruses. A lot of people in Europe and Asia have heard about foot and mouth disease, how difficult it is, how easy to spread it is because foot and mouth disease is an animal disease, is a non-enveloped virus. Then you have fungi, then you have vegetative bacteria, and the easiest to decontaminate, believe it or not, is envelope viruses, because they have this lipid layer outside that is, once you destroy the lipid layer, the virus is easy to kill. It affects the virus replication, it affects the virus likelihood to survive. And those viruses include the coronavirus, influenzas, and even Ebola virus. So, but when we're going to talk about decontamination a little bit, and these are some of the measures that you may need to take sometimes in order to mitigate some of the consequences of an outbreak or a job site contaminated, or a hospital, or in my case, laboratories. First is that we have, the terminology is that we have two types of decontamination. We have surface decontamination, like you'll see these persons here in the these laboratory technicians here in the picture, which they do a disinfecting or wipe down with disinfectant of all surfaces. The other type of decontamination that we typically use is fumigation of spaces. And for that, there are multiple technologies. They could be gas, vapor, mist, or plasma ionization. For example, but for disinfectant, the most commonly used disinfectants are alcohol, 70% alcohol, commercial bleach, and about 5 to 10%, a solution of commercial bleach like this one. You have cavicide, mostly used in laboratories and hospitals. Virkon, Virkon S is a product that is typically used in, I've seen it used a lot in agricultural labs and animal facilities and in farms as well. And Microchem Plus, which is a quaternary ammonium, that's typically what we use in our BSL-4 facilities for Ebola. Cavicide is able to inactivate bacteria like tuberculosis, and also some viruses as well. It's very effective. Also, Virkon, you could have inactivate up to 61 virus species, 33 bacterial species, and 6 fungal species. And Microchem is a broad spectrum bactericidal, fungicidal, and virucidal. It is I know in some countries, like in Europe, because it's a quaternary ammonia, there may be some restrictions. In other countries, like in the US, is accepted to use. But that's something that you need to find out, whether a product like this can be used in your country. For fumigation, we use multiple technologies to fumigate. Some of them is like formaldehyde gas. It's been used since the 1890s. Formaldehyde is very effective. For that, we use very simple materials like electric frying pans or equipment like the one in the right, that it will vaporize, it will gasify the paraformaldehyde, and then we are able to inject it into rooms or into housings or boxes, metal boxes. So for that, for example, we use 0.3 grams per cubic feet of paraformaldehyde, and to neutralize after the decontamination, we use 0.33 grams per in cubic feet of ammonium carbonate to neutralize the the formaldehyde gas before it can be released to the environment. Another technology that is used is vaporized hydrogen peroxide. Vaporized hydrogen peroxide, like I said, is a vapor. There are two two major vendors. One is Steris, which they produce a more dry process, and the other one is Bioquell, which is an English company. They provide a more humid type of vapor, but also killed by microcondensation. At the end, both inactivate by microcondensation when the peroxide touches the surface. And they start with a concentration of 30 to 35% peroxide solution. That's what it's used for this piece of equipment. Right. There are some advantages, like, for example, there is less hazardous than formaldehyde, and I put it between quotes, less hazardous, because at the end, it affects pathogens and it will affect humans. If you go into a room, as a person goes into a room without the proper protection, it could kill a person. But it's less hazardous because it's not a true gas, so therefore it doesn't diffuse like a gas, like a formaldehyde gas or chlorine dioxide gas. Good thing is that doesn't leave any residue. It's highly effective, but it has some disadvantages, such as it may damage metals, like it may corrode metal. It damage plastics. Over time, it could destroy plastics. It has a good penetration, like I was saying, because it's a vapor. So basically, it doesn't diffuse. So if you have a room that is not gas tight, it's more proper to use vaporized hydrogen peroxide, because you don't have that problem of the chemicals diffusing out of the space that you are decontaminating, right? So it's also an advantage. And it can be absorbed. Another problem that it can be absorbed by paper, wood, concrete. So it may take some time to release the peroxide out of these surfaces. You see some pictures here of the two different equipments. Here on the left, we're decontaminating filter housings. That's where we have HEPA filters inside for the ventilation system. And on the right, you can see a storage system used to decontaminate a room. Another technology that we use for decontamination is chlorine dioxide gas. Chlorine dioxide is a true gas like formaldehyde, so it will diffuse and it will penetrate really, really well. There are two companies here in the US that commonly we use. One is DRS Laboratories, and the other one is Chlordices Solution. DRS Laboratory system, DRS system, uses tablets, which this tablet is inserted in water, and it produces the chlorine dioxide gas. The problem with this, since it has a limited amount of water and a limited amount of tablet, is it has only a maximum capacity of about 120 cubic feet. You could do more space with this technology, but you will need to remove the water, add more water, and add more tablets, and you have to use proper protective equipment when you do that process. The Chlordices system, it uses nitrogen in a chlorine diluted in nitrogen tanks, and this goes through some cartridges of sodium chloride. Let me show you. It's these cartridges right here. Once the chlorine passes through these cartridges, then it generates the chlorine dioxide gas. Good thing is that you could do up to about 70,000 cubic feet of volume space with this technology, and it will depend basically on the amount of chemical that you have, of nitrogen, of chlorine and nitrogen that you have in the tanks, and the lifespan of the cartridges that you have left. You could also, with this technology, you could also control concentration if you want to maintain low concentration and a long exposure time. The new technology that is out there right now is called ionized hydrogen peroxide. This ionized hydrogen peroxide, they have two systems. One is a handheld unit that is used to do surface decontaminations, and another one that is an environmental system that could be used for decontamination in rooms and decontamination of surfaces as well. For that, the hydrogen peroxide, about 7.5% solution of hydrogen peroxide, is sprayed in front of an electric arc, like you see in the picture here on the right. And this electric arc, or this plasma arc, breaks down the molecule of peroxide, generating reactive oxygen species, such as hydroxyl ions and free hydroxyl radicals. These reactive oxygen species are the ones that damage or oxidize and affect the agents or the pathogens and destroy the pathogens. You could also do room decontaminations with this technology as well, in case you need to do room decontamination like you see in this setup over here. And thank you so much for your attention. And if you have any questions, you have my contact email right there.
Thank you so much, Miguel. I think that we learned a lot from you today. You have a whole different take on the situation, of course, than we did. So I would like to thank you a lot for your contribution today. I'll take over the screen from you again. Let's see. Okay. I hope you're able to see my presentation again. Can anyone?
Yes, we are.
Yes, okay, perfect. Thank you so much. So again, Nico and Miguel, thank you so much for joining us today. Oh, my presentation went. I'm just gonna run through it again. Technical problems here. Sorry about that. So I'll just discuss the next steps with you. As we already said, all of the information will be shared, amongst which the bowtie templates, but also the presentations and the recording of the presentations themselves. We already had a question, how can we get the software? You will receive a free trial for 6 weeks from us. Tomorrow, our event manager is going to do a follow-up show, so she will explain how this works and what you have to do. If you need support in getting started on bowties and the bowtie software, we will be doing weekly Wednesday sessions, and these are meant as an introduction and a demonstration in the bowtie software, and of course we will also cover the bowtie methodology again. And for further support you can always reach us, so don't worry about that too much. So we would like to thank you for listening in and joining the webinar today. I am asking my colleague Evelyn if we received any questions so far.
Hi, Elisa. Yes, we have a question from Eviserio from Brazil. Eviserio asks, could you please explain some mitigation barriers such as economic collapse, credit crisis? Eviserio, could you please unmute yourself so you can ask your question? And perhaps, Nico, could you perhaps give answer to this question?
Definitely.
Yes, can you hear me well? It's Eviserio from Brazil.
Yes.
Is everybody hear me well?
Yes, I can.
Yeah, okay. So thank you, Evelyn, for the opportunity to share my question, and also congratulations, Nico, and of course, CG for the initiative. And my question, Nico, is regarding your presentation. First of all, amazing job that you have done, and a really congratulations for this. I hope that our government maybe have some equal inspiration and do something similar to manage this situation that we're facing here in Brazil as well. So the question is directed to the consequences, as you put some barriers, very interesting barriers, but for me, and maybe for other colleagues, was not very clear the way that you described some of these mitigation barriers on the right side of your bow tie. For example, I just put 2 examples, but we could see more of this, like economic collapse or credit crisis. In terms of a bow tie concept, it's not very clear for me the way that you describe this. So I try to understand that this may be a contingency plan, for example, credit crisis, if you meant that, or if you use another approach in terms of concept to describe these barriers. So the question is just to explain more, how did you describe these mitigation barriers, and why they are described it like this?
Thank you, Rico. I just want to, sorry, Elise,
Yeah.
can you just Can you make me
the presenter again so you
yeah,
can use your screen? Yes.
please? Oh, thank you. Just want to get that there out there. So what you were asking there, Rico, is that I think it's the financial distress day. If we're looking at that, our and I think many governments has got a number of barriers that they are building in, like support systems and donations and getting funding from other countries, possibly for the smaller businesses. What was put in place for this one actually here, the first barrier there. The reason why I was putting this in the bow tie was because of the X-Mind, just the mind mapping, the spitballing that we have done, and that with the spitballing, with a process that we've got with the bow tie, that we can actually go back to our audiences and say, is this really a control or not? Is it really something that has to be in there or not? Can we rate it or not? What do we have in place there? So what you've got here is actually a huge brainstorming session that has actually brought out all these pointers. And with this, the next phase is now, how do we address each one? Because each one of those are actually something that can have a huge consequence on the country economy, our dependent countries that is around us, as well as on a global economy as well. In Brazil, I think we are in the same economical line. So what is happening in Brazil is affecting the financial situation in South Africa as well, and vice versa. So I think we are sitting in the same situation. But what we've got there was just a presentation of a few of our clients, their brainstorming and what we got out of that.
And what I would like to add to your answer, Nico, thank you for answering the question. What I would like to add for you, Rico, is maybe that you can also decide that your whole financial distress is going to be a separate bow tie, of course, because if it doesn't fit anymore into the scope of your initial bow tie, you can always decide to have a sort of chain bow tie situation, so that you move further away from the initial bow tie and focus really on the financial aspects. That's also a possibility to keep it completely separate from the initial one. Is your question?
All right, thank you very much.
Yes.
Thank you, Nico. Thank you, Elise.
Okay,
thank you.
You're welcome. Evelyn, do we have some more questions?
No, the questions we had is already answered. So about the how can we get a trial of the software and how we're going to go further. So if perhaps someone else has a question at the moment.
Maybe if someone still has a question, you can unmute your microphone and just pose it right away. That will be quicker. Okay, I suppose there are no questions left. Then I would like to thank all the attendees for joining the webinar today. As been said, the follow-up will be tomorrow, so you will be provided with all the materials. Again, Nico, Miguel, thank you so much for joining. And I would like to wish everyone a great day or evening, depending on where you are. Thank you so much for listening in, and goodbye.